Hey there, welcome to Men Thrive, where we discuss all things health and well-being. What we're going to discuss today is perimenopause. It's a really misunderstood, lesser well-known stage of life for many women. So I want to dive into what a lot of the symptoms are, because a lot of people know about hot flashes and that's kind of about it. And the periods might change, and other than that, if you're having anything else, then it's definitely not perimenopause. Maybe you get blood tests, maybe it's in your head, maybe there's nothing we can do to help. And that's what a lot of women get told. So I'm gonna break down what's really going on in perimenopause and help you understand what's going on better with your body. So what exactly is perimenopause? Well, we go back to what is menopause. Menopause is the point in time that you've reached when you have had no periods for 12 months, which is a little tricky to know if you'd experienced that, if you've had ovaries removed, or if you have IUD such as the Mirena, so you're not having periods. But before a woman experiences menopause, she would typically experience a decline in ovarian hormone production, and this lasts typically 7 to 10 years, can be a little bit shorter, can be a little bit longer. And it typically starts for a third of women in their late 30s, the other third of women in their early 40s, and the other third of women in their late 40s. So there's quite a range of when women are entering into this phase, and also a big range for when their final periods stop, which is around anywhere between 45 to 55 would be considered within that typical range. So it would be really, really nice for everyone if perimenopause declared itself with a very typical and universal symptom that everyone would get and everyone would know, now my body is experiencing perimenopause, but it really doesn't start like that. So thanks for waiting. Now we're going to get into the 34 symptoms of perimenopause. Are there just 34? No, but these are 34 important ones and ones that I see in clinic a lot. So first off, obviously we all have heard about hot flushes or hot flashes, depending on where you come from in the world. And sometimes they're called night sweats when they occur at night, because often women wake drenched in the night, feeling very sweaty and very wet, and sometimes very cold because the coldness has woken them up. Now, although this symptom is felt in the body, what we know is it's really a neurological change that's going on in the brain. So there's a dysregulation of temperature regulation in the brain, which sends out hormones and messages to the body to change the temperature in the body. Difficulty falling asleep, difficulty staying asleep, waking early in the morning. These are all incredibly common symptoms of perimenopause. So often women are like, I've been sleeping well all of my life, nothing's changed, my stress levels are no different. Now I just can't fall asleep, or I'm waking several times a night. And sometimes this is related to other symptoms, such as the hot flashes or the night sweats that are waking a woman, or frequent urination. But other times it's just the way that the changes in estrogen and progesterone are impacting circadian rhythm and body clock genes. And so supporting this is really important. Yes, we can do sleep hygiene, but sometimes adding back hormones and keeping those levels a bit more stable is what women need. Changes in mood and mood swings, irritability, these can be really frustrating symptoms for women. Again, often it just comes out of the blue. A woman can burst into tears for what she feels like is no reason. She's not feeling sad. She's just sometimes feeling overwhelmed, and it can just come out of nowhere. Often women are saying, my life is good, my relationships are great, I'm exercising, I don't know why I'm feeling like this. And we know hormonal changes in the brain have massive impacts on all of the neurotransmitters: dopamine, noradrenaline, serotonin, GABA. And so these rapid fluctuations and variable fluctuations can cause real significant mood disturbances for a decent number of women. New onset anxiety and panic attacks, or a worsening of anxiety and panic attacks, can be really disturbing for many women. Anxiety seems to come in two varieties that I notice: the anxiety that is associated with excess worry and concern. So some women become very anxious about health, especially as they're experiencing a lot of symptoms that nobody can seem to explain what is going on in their body. And other people have experienced more of a fear of dying or becoming really quite unwell. Other people experience anxiety more as these physiological symptoms because they're feeling their heart racing a bit more, they're feeling a lot of tension like inside the body. So that is not necessarily an anxiety in their head, where it's more of a upregulated neuroendocrine system. Panic attacks that occur can be really problematic. They can be associated with shortness of breath, with palpitations. They can often wake women during the night when there's nothing to be panicky about. But then certainly when you wake up with those symptoms, you definitely feel concerned. Often women with these symptoms end up in the emergency department. They get a full cardio evaluation, ECGs, blood tests, everything is normal. You're just anxious. Go home, you'll be okay. And nobody's thinking about hormones. Brain fog is really common. It's really problematic for many women, especially in high functioning jobs, when you can't find the word on the tip of your tongue, when you stop mid-sentence and are trying to grasp what you're even thinking about, when you go into a room to grab something and you don't remember what you're doing. It can be really distressing. It can affect people's work. It can affect relationships. And it can make people feel like they're actually developing some early onset dementia, which you are not. However, this typically settles down, but it's a long time, 7 to 10 years, to be experiencing brain fog, difficulty concentrating, difficulty with memory. I've noticed that vaginal dryness, typically in the early parts of perimenopause, can be a cyclical phenomena, so often occurring around the premenstrual phase when hormones drop low. So women may not experience any vaginal dryness during the rest of their cycle. But as women get further and further closer to their final periods, as well as in the post perimenopausal period, those low hormones impact vaginal dryness, vulval dryness, urethral irritation. That whole genitourinary tract is lined with estrogen and testosterone receptors, and so the loss of those hormones has lifelong impacts in terms of vaginal dryness, changes in the microbiome, increased risk of urinary tract infections. So it's really, really important that vulval vaginal skincare is put in place from the get-go. Breast pain is common. It's often cyclical, often associated with these higher levels of estrogen. But obviously, if you're noticing changes in the breast in terms of lumps or anything concerning, you should make sure you see your healthcare provider so that they can evaluate that for you. Weight gain is a really common symptom of perimenopause. It often starts before periods have started changing. Women notice that they're gaining weight despite no changes in exercise or how they're eating. And in fact, often they will change the exercise and eating in an improved way and continue to notice weight gain. And this is due to this loss of estrogen and a shift from the gynoid body composition to a more android body composition with more visceral adiposity or visceral energy storage, around the organs, and we know that this type of body fat composition is associated with increased risk of cardiovascular disease and diabetes, and it's directly driven by the hormonal changes that we see at perimenopause. Alongside these changes in body composition, we also see a few other changes, and that is loss of bone density, which starts a good 8 years before your final period finishes, as well as loss of muscle mass and strength. And we know that these two things together contribute towards significant impairment in later life. So significant loss of mobility, significant fragility, as well as significant chronic pain for women. If you develop a fracture, which is not necessarily a fracture from a fall, you can just develop a fracture in terms of gravity pushing on your very weak bones, and this causes incredible amount of chronic pain. So keeping the bone strong, keeping the muscles strong is really, really important for ongoing mobility and quality of life as we age. A lot of women experience changes in their sexual desire and ability to orgasm, and this is related to a whole bunch of changes around hormonal changes: reduced estrogen, reduced blood flow to the clitoral area, reduced testosterone, impacts on desire, which occurs in the brain, as well as pleasure and reward and drive. These are all aspects that are impacted in sexual function, as well as if you've got some vaginal dryness or discomfort going alongside these hormonal changes, that's also not going to help. You want to get in the mood. Estrogen and testosterone are really important hormones for keeping your pelvic floor well toned, as well as doing exercises, but also as well as to keep the urethral and bladder tissues healthy. So as we experience changes in those, these contribute to both stress and urge incontinence and overactive bladder. So it's really important that we seek appropriate management for these conditions because they are not inevitable. Hormone support and pelvic floor support are both really important for these conditions. There are many changes associated with the skin with changes in hormones. Those include loss of elastin, loss of collagen, loss of hydration. They also include really dry skin, so the skin loses its oil production and can be really itchy for some women. And also some women can break out in hormonal acne that typically is cyclical, and they also can experience it mostly along the jawline, is where it typically appears in perimenopause. Estrogen and progesterone have important roles in gut function. They influence the microbiome, they influence gut motility. So we've got our classic pattern of hormones that women have experienced through the menstrual cycle, and often some women will notice they get a bit constipated in their luteal phase or a little bit of loose bowels around the time of their period. But with kind of fluctuations that are experiencing during perimenopause, these symptoms can be wildly different. So a lot of women will experience thinning of the hair or some hair loss over their lifetime. Perimenopause is a time when some people notice that happening more, as well as times like pregnancy or postpartum. And so changes in hormones can just cause widespread diffuse loss of hair. There are some women that have female pattern hair loss, which is associated with higher testosterones compared with the estrogens. And in that case, there is thinning of the hair along the hairline initially. And then there's another third type, which is a fibrosing type of hair loss, frontal fibrosing alopecia, which often occurs with hair loss going in this direction. And that often requires a biopsy, and it's an autoimmune condition, but it typically occurs in this kind of postmenopausal period. So period changes, they typically, the cycle becomes shorter, but obviously there's a whole range of hormonal changes that can happen for different women. Some women who are particularly susceptible to those higher estrogen levels in early perimenopause can develop fibroids, can develop adenomyosis. These are both conditions that can cause heavier bleeding. So periods can be heavier, they can be clotty, they can be, in severe cases, they can cause flooding, which can be really, really disruptive to work and home life. So if that's the situation, if periods are very heavy, it always needs investigating. But other than that, there are definitely some really good treatments that can be used. And if periods are getting heavy, you should definitely seek treatment from your health provider for that. Eventually, of course, the periods do become less regular, with longer gaps between the periods, which can be a few months, and eventually it spaces out to an entire year, and then hopefully no more periods. Low energy is a very common typical symptom of perimenopause. Sometimes that is associated with the crappy sleep of perimenopause. So if you're having difficulty going to sleep, waking multiple times through the night, or waking at 4 a.m. every morning and unable to go back to sleep, then this is going to impact your fatigue levels and your functioning during the rest of the day. But sometimes women are feeling fatigued even though their sleep may be okay, and this is also, again, most likely due to hormonal changes during this time. So we know that by the time a woman reaches around 40 years of age, as I said previously, very low egg reserve, fertility, pregnancy is harder to achieve. However, it still does happen. So if you don't want to get pregnant, contraception is really, really important. But if you do want to get pregnant, it can be a struggle. And a lot of women that I see for fertility reasons are in the early stages of perimenopause. So gum disease and teeth issues can become a problem during perimenopause. You may have had great teeth, you may be brushing twice a day and flossing, but develop some worsening of gum disease or new onset of gum disease. I've spoken with my dental hygienist and read some papers about this, and there is a definite connection between these hormonal changes that occur. So it's really important to stay on top of your dental hygiene during these years, so that we can keep the bugs out and keep the gums really healthy and strong. Along with other gut symptoms, some women experience bloating, and other symptoms include reflux. So a lot of women are being transitioned onto reflux medications at this time. Besides skin changes, we see changes to the nails, so the nails can become more brittle, more fragile, and break easier. Dizziness can be problematic for some women, and that can be related to dysregulation in body temperature, dysregulation in blood pressure, dysregulation in blood sugar levels, and all of the above. Additionally, another form of dizziness, which is slightly different, which is vertigo, which can appear like the room is spinning. Some women can experience some type of vertigo symptoms in association with their menopause, perimenopause. Some women will experience an increase in vaginal infections. This is due to falling estrogen levels is associated with falling lactobacilli levels in the vagina. So lactobacilli keeps the vagina flora very healthy, and when you have a loss of that, you can have more thrush or more bacterial vaginosis, which can cause unpleasant discharge symptoms and irritation. Headaches. This is a bad one. So a lot of women with migraine will experience worsening of their migraine. Initially, that may be menstrual migraine, like around their premenstrual period, but sometimes it can persist throughout their whole periods, their whole cycle. Other women will develop new onset migraine, and other women will develop worsening or new onset of tension headaches. And this can be really debilitating if you're having a couple a week, throwing you off work, or having to take lots of painkillers or lots of migraine medications. Have you ever heard of formication? This is a wild symptom, which I do have a number of women that describe this symptom to me. It is a sensation of something crawling under your skin, which sounds so disturbing to me. And other women, I've had them describe that they feel like they have nits crawling around in their head. Like it's an unpleasant symptom. I've also had patients who've told me that their mothers experienced this, but they were not allowed to tell anyone in case they got locked up. Wild. So these next two are not necessarily strictly symptoms of perimenopause, but they are ways that perimenopause can manifest and influence the body. So some people at perimenopause, because of the hormonal changes, can have a autoimmune condition that they have a underlying genetic susceptibility to, can kick off at this time. And the most common one that I see in clinic is Hashimoto's thyroiditis, which is a hypothyroid or low thyroid hormone. So every woman that comes in with fatigue who's thought to be in perimenopause, also needs to get their thyroid checked, because often they've got both going on together. Other common ones that occur in this age group include rheumatoid arthritis. It's really quite common as well. Likewise, women with allergies such as hay fever or asthma can have a worsening of their control of their symptoms, because fluctuating estrogen causes fluctuating histamine, and this can really aggravate allergy type symptoms. And going along with that, some women develop oral symptoms. Some of them, it's a burning mouth syndrome, and for other women it's an oral allergy syndrome. So when they eat any kind of fruit or fruit skins, they can be triggering these irritation, burning sensations in the mouth. So there you have it. We've got about 34 symptoms of perimenopause. I wonder how many you've experienced and how many of them have been connected to perimenopause, how many of them have had no explanation discovered for them when you've had investigations. I know you're wondering, what can help? What can help with perimenopause? A lot of people think, well, I can't use HRT because that's for after menopause, but that is not the case. HRT, hormone therapy, can help with perimenopause because it can help stabilize these fluctuations in hormones. And there are also a bunch of lifestyle things that you can do to improve your health and well-being. Often you're better able to do that when you have more stable hormones. So when you've got more stable hormones, you feel better able to exercise because you have energy, and you're better able to eat well because you have energy to plan and organize and cook and purchase and do all of the things that you need to eat well. Self-care and stress management is really important. So yoga, meditation, stretching, taking a walk in nature, all of the things that like replenish you and fill you up and make you feel good. Make sure you do those things, as well as getting to sleep. If you can't sleep with the HRT on board and doing all the usual sleep hygiene things, then melatonin can be really helpful as well. Remember, perimenopause, it's happening to all of us. It is a natural state, but that doesn't mean that you don't need to treat it. I mean, come on, an infection is natural, but we treat it with antibiotics, right? It's nature getting stuck into you and giving you an infection. So talk to your healthcare professional. Make sure it's someone who's informed about menopause in 2024, because a lot of us have not had great training. We've had to seek it out ourselves, dig deep, read the articles, get on top of the research. That's what you need in your health provider, because you want to be given appropriate care for you. Thanks for listening to Men Thrive. If you found this useful, don't forget to subscribe, don't forget to like and share it with anybody else that you think will benefit from it.